Hi guys, good evening. Thanks for the guys at Depot 8 for hosting us this evening. Really great event. My name's Aaron and I'm a junior doctor at the Royal Melbourne Hospital, so I'm third year out. And today I want to talk to you about StitchMD and our idea about turning flowcharts into apps. So the structure of this talk is going to be, we'll talk a bit about what our idea is, give you a quick example, and then I'll talk about 3 problems that we're tackling in the healthcare industry. And these problems, all of you as healthcare startups will have to consider these as well. So hopefully I'll explain a bit about context of the problem so you guys understand it from a doctor's point of view. And the last part, I'll reveal our secret sauce, what we think will help us be successful. If you guys use this as well, we think that you will be successful in your startup as well. So I'm really excited to show you something, and it's actually this ad from Hitachi. I'm not getting paid for this. So what if we could all be doctors? Looking at this ad, you think, oh, it's a bit childish. There's a kid there. It's a bit silly. He's listening to a teddy bear. What's he doing? And finally, some of you might be thinking, is this even possible? Now, I'm very excited because I think it is. And that's why I want to talk to you about StitchMD. So what we're trying to do is we want to help untrained health workers accurately implement practice guidelines. And we want to do that by simplifying the navigation of complex guidelines into simple question and answer screens. So lots of words, let me just show you. So right now, this is our backend website. It's not fancy. You can enter in a if, then, else statement using just a classic form. Where we want to go is we want to move it into a user-friendly interactive design where you're actually drawing a flowchart. But already our system does this, and it converts that little box there into a simple question and answer on your mobile app. And as you enter yes or no, you go through and you're directed to what you need to do, so to-do list. And this can affect all areas in in the healthcare system. So why tackle this problem in particular? Because there's lots of things we can do. And the answer to that is that because this affects safety, quality, and quantity of the healthcare that we can deliver. And these are the 3 problems that I want to talk to you about next. So just a bit about Health 101. People hate being sick. Okay, that's why we have the healthcare industry. And as health workers, if you understand that, then you understand that what we do is we're in the job of problem solving. So we go and assess a patient who has a problem. We formulate a diagnosis, or why are they encountering a problem. And we create a management plan and we take action on that. And things that limit us right now, technology, telecommunications, we have to work on desktops. We're restricted in, can we contact the boss to get a plan? But really at an individual level, we're limited by the time we can spend with a patient one-on-one, and also the amount of training we have as an individual. And so hopefully this app will, this idea will get past that. So the first problem is about safety, and safety is a big issue in healthcare. So as a doctor, I had to take an oath, and one of that is, say, first, do no harm, or non-maleficence. And actually, from the 1990s, they've already released a report that said, in the United States, they're estimating that 98,000 preventable deaths were happening per year. A new study in 2013 actually suggests that's more closer to at least 200,000. So that's in the US. Closer to home in Australia, that number is at least 18,000. And so this is very much a real problem. And what you have to consider when you're creating your startup is, where do you fall in this model? So this is the Swiss cheese model. So you can think of each of these Swiss cheeses as parts, maybe processes in the healthcare system. I like to think of them as individuals who are part of a medical team. And you can think of the wholes then are mistakes or errors that happen. Everyone makes mistakes. That's because we rely on the individual's expertise, like I told you, their training, but there's a limit to that. And when all these holes line up, you have a mistake that goes right through and impacts on a patient and they get hurt. And when you as a healthcare startup are creating your product, you need to think, am I adding an extra layer of cheese there? Am I making the holes bigger, better, worse? You need to consider, are you making this, a more, impactful thing on everyday care for a doctor? And what we're doing at StitchMD, what we think our product will do, is actually make those holes smaller, or ideally change it fundamentally to cheddar, so no holes. So where did this idea come from about safety and tackling this app? It's actually, in my experience, going to Horsham. So at Royal Melbourne, we have this rotation where we go out to the country. For those of you who don't know, Horsham is remote. Very, very remote. According to Google Apps, from here to Horsham, it takes right now 3 hours and 30 minutes by car. That's assuming, I think, perfect driving conditions. And out there, they see something like 11,000 admissions per year. So Royal Melbourne has a very interesting relationship with them because every 3 months, 11 fresh new doctors or interns get rotated out and are put into key positions in that healthcare system. And so they released a study back in the 2000s, and on the left-hand side, you can see, the sorts of treatments that patients were getting, whether they were getting best practice care for stroke, and on the right is best practice care for for a STEMI, so a heart attack. And you can see that although we know what we need to do, we are not doing it. And part of that is maybe fresh new staff, they don't know the process. And so what they did was they started implementing this solution. And this is, so the solution is clinical pathways or checklists. If you want to read more about it, you should read the Checklist Manifesto by Atul Gawande, where he talks about just how checklists alone can improve the standard of care and make sure that people translate what they know into what they practice. And at Horsham, they took it to the next step and they developed clinical pathways. So clinical pathways are checklists, but day-to-day for a particular condition. And so they implemented these clinical pathways, and they published their results. And so for stroke, you saw that after they implemented it, 2 years down the track, there was significantly improved compliance, but it's substantial when you look at it in terms of heart attacks as well. So these really simple things can make a big impact on delivery of care. And we think that at StitchMD, these simple ideas about checklists and guidelines, if used, help people translate what they know into what they practice. And so we, at the time I was really excited. This idea hadn't been formed yet. And I asked them, this idea is brilliant. You need to make an app, because what if you want to mix guidelines together? He said, well, we've tried, we've applied for it, but we don't have the ability or the money. And I was very sad about that. And unfortunately, that's a realistic sort of situation in healthcare today. And so what we want to do at StitchMD is we want to help them really in their next iteration and to bring these checklists and clinical pathways to mobile and do it affordably so that hospitals can do what they do best, which is look after patients, and then they can rely on developers to create technologies to help them do that. So that's the first problem. And there's lots of examples where they're using clinical pathways and where StitchMD probably can fit in. So there's things like the heart attacks and the strokes, but also standard checklists are already incorporated in hospitals for things like preoperative care, making sure you don't have a very dangerous murmur before going into hospital, and postoperative management as well. So the second thing second problem in Australia's healthcare system, and when you're trying to create a solution, is to understand about quality. So we have safety as a minimum. Next, we have high quality requirements in Australia. And a part of this is also cost effectiveness. So you have to understand that in Australia, we're actually pretty good. It's really nice. So up there, we're sort of in the top 6 countries in terms of life expectancy at the age of 65. Here, this really just shows us compared to every other country and how much we're spending. So we're actually not really spending that much compared to them. So we're very cost effective. And what that means is it is quite difficult when you're trying to create a new solution. And already, newspapers are clamoring, tough choices, how to rein in Australia's rising healthcare bill. But when you actually look at the numbers and the statistics, it's actually the recent rise we do see and everyone's harping about is mainly about the new and improved services per person. So we're using more healthcare services, we're creating more product, and that's costing more. What's important to see though is that actually the population aging component is not a big role currently, and that's actually going to worsen in sort of the next 40 years or so. So if you look at that, Australia will have a jump in sort of 8% in the number of people who are over 65, and those are the people who will be using healthcare services. So what you have to understand is Australian healthcare is great, okay, already. So the main issue is we need to make it more cost effective in preparation for the future. So what we at StitchMD think our technology does will enable something called task shifting. So you should read this HBR, so Harvard Business Review article from 2013, which analyzed innovative healthcare clinics in India and compared them to the United States. So you have to understand, though, take this with a grain of salt, that that India and the US, their health outcomes are not as good as us in Australia. So with that in mind, though, really the thing they noted was that, well, in Australia, you first have to understand that the ratio of nurses to physicians is around 3 to 1. The way they are doing task shifting is really, allocating jobs to healthcare workers in the most efficient way possible. And that means shifting things down to lower costing health workers if possible. And in India, they were achieving nurse to doctor ratios of at least 6 to 1 in those innovative centers. So there's a lot of room for improvement for us and for saving money. And honestly, nurses, I think, are right now an under-tapped resource in Australia. And if you want to understand, I guess, how they have the potential to disrupt doctors, you should read the Innovator's Prescription by Christensen. But essentially, with new, more up-to-date education and software, the quality that nurses can provide the care is, reaching a critical point where it'll be just as good as some GPs, at which point they will disrupt GPs and take over more and more roles. So they would be the sort of the red line. And so nursing practitioners in Australia haven't taken off yet. And because, like I told you about, the healthcare quality is so good, but in other areas like the US or in India where health quality by doctors is not that great, nurses already, they've already reached that point at the bottom line where they're delivering the care that's enough, just enough. And that's why they're already sort of taking over. But I think it's going to happen in Australia down the track. So in the States, you're seeing minute clinics that are popping up that are doing a lot of the things that GPs are already doing, managing lots of common illnesses. And some of the data that's come out there suggests that it's a lot more cost effective. So in the bottom right-hand corner, that they're really saving money. And we think that the issue then for Australia is about the quality of care that nurse practitioners can provide. And one of the things that we think we can do is help with this, and this sort of diagram will show you. So traditionally in our system right now we have 3 nurses to 1 doctor, and right now we have the internet. And right now, for people to stay up to date on best practice, they have to utilize the internet and read up on it every time. And that's not efficient use of their time because you have so much resource out there to search. What we're thinking we can do with StitchMD is really change the relationship between doctors to nurses and help with this task shifting and improving these ratios. So hopefully, 1 doctor can look after 9 nurses and using our app and giving structured guidelines, and that doctor would then look after creating his guidelines and pushing best practice to his nurses who will be using StitchMD. And this way the nurses themselves can be focused on delivering care. So nurses already have a lot of role in the healthcare system today, and we think that they're going to take even more role in the future. So there's a lot of potential, I think, for StitchMD there. Finally, the third problem I think you as health startups need to understand is this problem about the quantity of health. I think right now the quantity of health is best described and limited by this sort of relationship, okay? A doctor seeing a patient. That's traditionally been the model. That's what the model we're really still using right now. Maybe we might just add another nurse in there. But it's still, you might get some ratio. Now people are creating startups where they're using the internet, but you're still getting a doctor spending his time answering an SMS message or answering an email. And yes, you can use a nurse, but really that ratio of doctor to patient is still nearly 1 to 1. And what we think we can do with StitchMD is we're putting a middleman here who can do those things in ensuring safety and also improving quality if a nurse gets involved. But really, it's sort of acting like as a new gatekeeper, through the internet. And so what we're trying to do, another way of looking at StitchMD is really capturing ideas. how doctors think about a problem. And it's very important to capture this because it's different for every doctor, it's different for every specialty, it's different for every context. Some people are using things like Watson, IBM, the one-stop solution, this artificial intelligence, but that's not the solution because that's saying there's only one way. In fact, there are multiple ways. And that's why it's important to keep the consultant, the doctor, involved. So the first part we're doing is capturing the ideas. And how we're going to deal with quantity then is with these upcoming enabling technologies. So we already have mobile devices. We've seen a proliferation of standard platforms. We're getting cloud computing with AWS. The next thing that's going to come up soon is going to be a proliferation of sensors. And even point-of-care labs where you get a pinprick and you can get all your bloods from that. Now, what that's going to do is help create something called the quantified self. You guys have probably been reading a lot about in TechCrunch. But you have to understand, from a doctor's point of view, that just creates too much data. It's not possible for someone to deal, with that quantity of data to have to spend so much time to deal, to manage that. So you're moving to this model where you're requiring automation, and that's why it's important to capture what doctors are thinking so you can automate it. So the traditional model in healthcare has, you have that one-to-one interaction, you have a session, you see a doctor, you have to see them every 3 to 6 months, and that's the time when you get feedback from him. Where we're moving is the future model is going to be continuous assessments by computers. And then risk-based assessments where, if something's going off, then you get triaged by the computer system and the doctor will see you. And you get rich analytics that comes out from that so that the patient can log in and see how they're doing themselves. And ultimately, what that means is that we're moving from patient being a passive role in the healthcare system to patient being engaged and very active in their own care. And all of that can be done with technology, and we think we can do that with Stitch. So this is particularly important for chronic conditions and also for disease prevention, I think a lot of people know about. So finally, thanks for staying with me for such a long time. I know this is a long talk, but we finally come to our secret sauce. And the secret sauce has to do really with, how are we differentiating ourselves from all these people? So this is the Internet of Things, another trend that's catching on. And I think we are sort of competing in the Internet of Things. We're trying to create like a horizontal platform. And one of the ideas is about disruption and understanding disruption really well, which is that disruption is really a trend of convenience. So convenience means we're actually eliminating limitations of our current system. And we think that StitchMD, we're eliminating the limitations of time, training, and communication. But that's actually, that was what I first thought was our secret sauce, but that's not our secret sauce. Our secret sauce is really understanding that medicine is about people. I think that, coming from programming, that can sometimes be lost, but as a doctor, it's about day-to-day, helping someone cope with their illness, empowering them to take a stronger hold of their own health. And why I'm really excited with StitchMD, because the idea is really about empowering people. It's empowering health workers, and it's empowering individual patients as well, ultimately. And the way we're doing that is by decoupling knowledge from practice. That's why checklists work so well, is because someone puts all their investment in time and expertise in making a very simple list, but anyone else can apply that list and get the amazing outcomes. And I think at StitchMD, we're enabling that idea to happen with mobile technology. So going back to our original, exciting ad by Hitachi, what if we could all be doctors? I'm very excited to tell you, I think with StitchMD it's possible, and it is, part of our future. So thank you very much for listening to me.